Hello everyone, my name is student Dr. Lisa Ann Suba and I am representing myself along with my colleagues, student Dr. Sydney Pirkle and Dr. Garen Gebhardt, with our presentation today, Comfort of a Transgendered Person with OMT, a Case Study. To begin with some background information, the definition of a transgender individual is a person whose gender identity does not correspond with the sex registered to them at birth. The Williams Institute estimates that there are 1.6 million persons above the age of 13 in the United States that identify as a transgendered individual. Transgender individuals may avoid or delay seeking healthcare services and often do not disclose gender identity due to fear of discrimination. These patients often experience poor health outcomes and often avoid seeking medical care secondary to previous negative encounters with providers. These negative encounters can include stigmatization, insensitive language, being denied care, or ridiculed for their gender identity. The table at the bottom of the slide is referenced from the National Institutes of Health, and its aim is to highlight the differences and interactions between sex and gender to better understand how they affect health and why they are important in medical practice and health research. The aim of our project was that through the integration of OMT, osteopathic manipulation treatment, and the biopsychosocial approach, we can improve chronic pain experienced by a patient who identifies as transgender. We were referencing the first osteopathic tenet of the body is a unit, mind, body, and spirit. Participants were recruited from an established patient population at the Oklahoma State University's Osteopathic Manipulative Medicine (OMM) clinic in Tulsa, Oklahoma. Verbal consent was obtained from study participants to utilize their medical history, chief complaint, hormonal management, and answers to survey questions regarding their interactions with and opinions about healthcare experiences. If a patient was a new patient to the clinic, recruitment procedures were deferred until a follow-up visit, and patients chosen were adults and did not require a guardian to obtain consent. This case study is centered around a 20-year-old transgender male with history of asthma and anemia presenting to the OMM clinic with complaints of right-sided mid-back pain unassociated with any recent injury or trauma. He described this pain as chronic and daily and a 2 out of 10 on the pain scale that day. This pain was noted to be relieved with over-the-counter ibuprofen and with lying down, meanwhile being worsened with sitting in a chair and lifting objects. Physical exam had revealed that there were somatic dysfunctions of the respiratory diaphragm, thoracic and cervical spines, and cranial structures. A variety of techniques were utilized, however, the most effective modalities were myofascial release, articulatory techniques, and high-velocity, low-amplitude treatments. After the third treatment, the patient noted considerable improvement in his symptoms. He reported increased thoracic spine mobility followed by each treatment. The patient reported being comfortable with all providers and students who performed OMT during his appointments. He expressed that the OMM clinic in Tulsa was a welcoming healthcare environment where he was able to feel at ease in discussing his medical history, concerns, treatments, and background. Our case study aimed to gain a transgender patient's comfort level during OMT appointments at the Oklahoma State University OMM Clinic in Tulsa, Oklahoma. He was one of many patients that were interviewed for the study, where the focus was to obtain qualitative feedback from patients. It is possible that this research can be guided to assess a larger scale of transgender patients with their comfort level and contribute to closing the disparity gap that currently exists. This study was limited by a lack of quantitative data of a comfort scale. Future research, including a survey with quantifiable measures such as a pain scale or comfort scale, would allow for statistical analysis. Here are our references for this study, and here's our contact information. Thank you.